Under the new long-term care policy, each staff member must do one of the following: provide proof of vaccination of each dose, provide a documented medical reason for not being vaccinated, or participate in an educational program about the benefits of the COVID shot and the risks of not getting one.
It's a good idea. It certainly makes sure that people have the information to make an informed decision.
We are not talking about mandatory vaccination per se. This is an imposition of a mandatory policy requirement, which is far different.
Tushar Anandsagar is a lawyer specializing in labor and employment.
This is not a new concept in law, and this is certainly not the first time that we've considered this issue, both as a legal system within Ontario or as a country at large.
In this scenario, the Ministry of Long-Term Care cites the need to build on the vaccine campaign. According to the province, 97% of Ontario's long-term care residents have been fully vaccinated, but that number drops to 66% for long-term care staff.
There are some homes with very low coverage rates.
There are 29 active outbreaks in long-term care homes in Ontario. Dr. Barbara Yaffe believes it's important to focus on the safety of the residents.
I think it will help a lot with the residents in particular, because if there is a case, first of all, there'll be a lot less risk of the transmission because people are immunized.
The policy is for long-term care only, not retirement homes, but the Associate Chief Medical Officer of Health says these kinds of measures could be used in other settings. It's a question Anandsagar receives every week.
They are more so interested in education and increasing the rates without pushing, without sort of mandating and drawing a line in the sand.
When it comes to the school setting,
right now the vaccine is not licensed for children under the age of 12. And the actual schedule going forward is still to be determined, but I can see certainly potential in the future for that.
Last week, Western University said a COVID vaccine will be required for students and residents, but McMaster is taking a different approach.
And as the vaccine rollout ramped up, we decided not to require vaccines.
McMaster's Associate Vice President of Students and Learning says they're focused on education on campus and are confident most students will be vaccinated.
If we had required vaccines, I think that gets you into a whole bunch of other issues, including just the administrative burden of trying to ask people for their medical information, keeping track of that, following up on that.
The decision was made in consultation with Hamilton Public Health and top researchers at the school. Nicole Martin, CHCH News.